Hello, and thank you for joining us today for this webinar on the impact of COVID-19 on health centers in rural America. My name is Joe Dunn, NACHC Senior Vice President for Public Policy and Research. I'd like to first express a welcome from NACHC President and CEO Tom Van Coverden, who wanted to be here today but couldn't attend. I know that I can speak for Tom when I say that we really appreciate the staff of individual community health centers, PCAs, HCCNs, and the NACHC staff for all the sacrifice and hard work during this pandemic. COVID has shined a light on what we have known for a long time. Diseases do not discriminate, and there is health inequity in this country. Americans face significant challenges when it comes to healthcare, and those challenges are magnified by geography and distance for those living in rural and frontier areas. Whether it's a lack of access to medical care, oral health, behavioral health, or not being able to get prescriptions filled, these have long-reaching effects on the health status of people and their communities. Health centers are best positioned to address these needs. We know that in addition to health centers providing quality, comprehensive health care, they also create jobs and are an economic stimulus for their communities. This is especially true for rural and frontier areas, and Congressman Peter Welch and Congressman Tony Gonzales realize that as well. And we appreciate them participating in this webinar, as well as supporting health centers in Congress. Their participation is important also because it shows the breadth and diversity of rural and frontier communities. Rural America is different in each state in the country, and we're going to hear about two examples of that today. We're going to begin our program today by spotlighting various resources NACHC offers for health centers' most valuable asset, the volunteer board of directors. As we all know, board members are the lifeline to the communities in need, providing strategic direction, guidance, and input on how health centers can best address the needs of their patients. Today, we have Emily Hurd, NACHC's Director of Health Center Training, to share some information. So please take it away, Emily.
Hello, I'm Emily Hurd, NACHC's Director of Health Center Governance Training. It's a pleasure to be part of today's webinar. Since the founding of the health center movement in the 1960s, our patient majority community-based boards have been at the heart of the health center movement. We wanted to spend a few minutes today sharing with you various resources to support our health center boards. We hope you are already familiar with the Health Center Resource Clearinghouse, which contains various resources and tools to support health centers. It can be found at www.healthcenterinfo.org. We know that governance has not been easy during the pandemic. Under the COVID-19 resource tab on the left side of the clearinghouse, you'll find a special governance spotlight. I'd like to spend some time sharing what you'll find in this section. First, a generous grant from the Pfizer Foundation has enabled the development of resources in three main areas identified as priorities by health center board members: understanding the impact of the pandemic, framing the future, and strengthening the board's own governance processes. Let's take a closer look. To help boards understand the impact of the pandemic, a series of articles have been released on topics such as budgeting considerations and the impact of COVID-19 on key oversight areas, such as quality and risk management. Be on the lookout for videos coming soon that further discuss financial implications. To help boards think about the future, an article is currently available about strategic planning and thinking during this time. Be on the lookout for additional resources related to governance and telehealth. To help boards focus on their own functioning, resources are available about virtual board member orientation and virtual board retreats. Be on the lookout for additional orientation templates and resources on board recruitment. Additionally, given support from the Health Resources and Services Administration National Training and Technical Assistance Partners Award, additional COVID-focused resources are available on the virtual board meetings and board leadership, as well as a short video that outlines 3 ways board members can serve as ambassadors for the COVID-19 vaccine. Beyond the pandemic, various more general governance resources are available to support health center boards. Those items can be found on the Health Center Resource Clearinghouse under the main governance spotlight area. One foundational tool is the Governance Guide for Health Center Boards. This comprehensive guide outlines each board role and responsibility in the context of the Health Resources and Services Administration Health Center Program Compliance Manual and includes guidance on good governance practices. Topics include everything from board recruitment to financial and quality oversight to meeting and committee practices. The guide also contains a robust appendix, including 20 tools and resources that can be adapted by health center boards. Additionally, based on requests from boards and CEOs, a suite of short online videos and modules are available that can be used for the board's own orientation and ongoing education. Topics include a 5-part series that walks through how to read various types of financial statements. Additionally, 2 companion online case studies allow board members to put what they learned in the modules into practice. Additional videos focus on strategic planning, the board's role related to needs assessment, and accountable care for boards. Finally, various governance legal briefs, articles, and case studies are also available on the Clearinghouse on topics such as conflicts of interest and CEO compensation. Should you have any questions or suggestions for additional resources, please contact us at trainings@nac.org. Thank you for all each and every one of you do every day in support of health centers and health center boards.
Thank you, Emily, for that reminder about resources that NAC has available. Before we get to the discussion, I think it's important to level set and note how vital health centers are to rural and frontier communities. We know that there are nearly 600 rural community health centers with roughly 5,000 sites. Together, they serve more than 9 million patients, or 1 in 5 rural residents. Rural health centers are part of a broader rural healthcare ecosystem and are interconnected with rural hospitals. They're often located in close proximity to each other, with both serving as key assets in their shared communities. Unfortunately, we have seen over 130 rural hospital closures in the last decade. These closures greatly impact not only the residents' access to healthcare, but it also leads to significant job loss both at the hospital and throughout the community as the negative economic effects ripple through the economy. And we also know that this past year has been incredibly difficult for our broader healthcare system. And that has been true for health centers in rural and frontier areas. According to a recent analysis by Capital Link, rural federally qualified health centers have experienced a 25% decline in patient visits for much of 2020 as patients complied with stay-at-home orders. The health centers quickly pivoted to providing care virtually, with over a quarter of the visits delivered via telehealth. However, the loss in patient visits severely impacted health centers' revenue, jeopardizing their financial viability even as they continued to play a critical role in the pandemic fight. After taking into account federal relief funding, rural health centers experienced net losses of over $1 billion. Recent federal funding will greatly assist these health centers for their costs and prepare them to continue their response to the pandemic. However, as the great country music singer and native of rural Appalachia, Dolly Parton, said, "If you don't like the road you're walking, you start paving a new one." And that is exactly what rural community health centers have done for years. Their ingenuity and inventiveness have led to new approaches to delivering care. They've been doing incredible work to test and vaccinate their patients during this pandemic. Just in a 1-week period earlier this month, rural health centers tested 32,000 patients, initiated 117,000 vaccines, and completed 57,000 vaccines. And just a few days ago, the Washington Post featured the hard work of staff from Cahaba Medical Care, a health center in Alabama, as they were vaccinating their patients. The story details the extraordinary effort to scale up a vaccine program with little time to plan. Patient after patient says, that is highlighted in the article, say how they tried to find vaccine everywhere and couldn't find it until they came to Cahaba. The Cahaba staff are shown to go above and beyond to help, despite the mental toll that a year of a pandemic has done to them. But at the end of the day, despite the challenges of vaccine shortages, spotty internet, staff fatigue, and long drives, Cahaba is getting the job done for small towns in Alabama, like Uniontown and Marion. We know that this story could be written about so many different health centers from across the country who are stepping up to care for their patients and meeting this enormous challenge, because we've heard of these innovative approaches and stories from across the country. And so with that in mind, we're going to hear from two members of Congress today and their local health center leaders from their states. But first, let me introduce Deela Davis, NAC's Deputy Director for Federal Affairs, who is going to be moderating the discussion. Deela joined NAC recently after serving as the Director of Government Affairs at Access Community Health Network, a health center in Chicago. Deela, take it away.
Thank you, Joe. And it is my honor and pleasure to introduce Congressman Tony Gonzales. Congressman Gonzales is a 20-year veteran of the United States Navy who rose to the highest rank of Master Chief Petty Officer. And during his time of service, he was deployed multiple times in support of combat operations in Iraq and Afghanistan, as well as in support of regional security operations throughout Asia. Congressman Gonzales has served as a Department of Defense Legislative Fellow in U.S. Senator Marco Rubio's office and has been stationed across numerous naval installations in Hawaii and Florida. Congressman Gonzales received a master's in international relations from the American Public University, a graduate certificate in legislative studies from Georgetown University, and is a PhD candidate in international development, all while being a congressman. And he's also active member in his community. Congressman Gonzales founded the Tony Gonzales Foundation, a nonprofit focused on empowering and encouraging growth and development in impoverished areas in San Antonio. And Congressman Gonzales is no stranger to the struggles young people face, and that is why he and his wife, Angel, serve as CASA volunteers, in addition to raising their own 6 children. Bravo to you. And on January 23rd, 2020, Congressman Gonzales was sworn in as the 8th member to ever serve the 23rd District of Texas. The 23rd District is larger than 30 states, covers more than 800 miles of border, has 2 time zones. Which time zone are you in? And is the southern border district held by a Republican, the only southern border district held by a Republican. And Congressman Gonzales, he serves on the Appropriation Committee, sits on the Military, Construction, and Veteran Affairs Subcommittee, and the Transportation and Housing and Urban Development Subcommittee within the Appropriations Committee, and was chosen to serve as Assistant Whip to Republican Whip Steve Scalise. Welcome, Congressman Gonzales. And if I may, let me also introduce Monica Gonzales. And Monica has been a community organizer and advocate for over 30 years, both in her career and volunteer pursuits. She has received her master's and bachelor's degrees from Sol Ross State University in Alpine, Texas. Ms. Gonzales sought a career supporting members of the community to help them access available benefits, job placement services, and paths forward. She has carried this into her volunteering through regional healthcare and social service coalitions, the Chamber of Commerce, Salvation Army, and most importantly, as a patient consumer board member for the Community Health Development, Inc., an FQHC serving Uvalde, Real, Edwards, and Zavala County in Texas. Since 1998, Ms. Gonzales has been a member of CHDI's Board of Directors and has served as board chair since 2017. So welcome, Ms. Gonzales. So again, thank you. So thank you both for joining us today. Congressman Gonzales, thank you again. And I just want to throw out a question for you. Rural America, like your district, is not homogeneous. There is rich diversity. across race, ethnicity, religion, education, socioeconomic status, and political beliefs. Health centers see this diversity every day in their patients. But there is a general perception where the media may not necessarily tell this full story. So in your own words, how would you describe the diversity across the rural areas of your district? And why is access to healthcare important? Why do you feel health centers are well positioned to respond to the needs of these diverse populations?
Great, thank you. Yeah, thank you for the question. Thank you for the intro. You know, Congressman Henry Bonilla is a good friend of mine, and he warned me that y'all are a crazy bunch. So I look forward to our time here today. Look, I'm in San Antonio. You mentioned 2 time zones. I woke up in El Paso, and now I'm here in San Antonio. So I have a district that you're always on the run, always on the go. And you know, I grew up in San Antonio partly, and I also grew up in a small town, Camp Wood, just past Uvalde. There, 500 people in this town. And to me, you know, access to healthcare is critical. It's critical. You know, it's across demographics. You know, my district has both urban areas and rural areas, and I think it's important that you know, that I think the role that community health clinics provide is critical in that ecosystem. And I always talk about the healthcare ecosystem. What I try not to do is pick and choose winners. I think we can all be winners in that space. And I think there's a role for all these various different types of healthcare initiatives, and community health clinics certainly are one of those. Yesterday I was in El Paso, and I actually visited Juarez as well on the Mexico side. And I just mentioned that to go, you know, you have different types of clients that are gaining access to these healthcare facilities, and they're all important, and they all are critical to that ecosystem, if you will. And you know, my district, 820 miles of Texas and Mexico border, it's often referred to as the frontera, right? The frontier of things. And our community health clinics provide a critical role in allowing some of these rural these rural communities to have the resources they need, and not only just patchwork, but state-of-the-art, you know, quality healthcare. And it's just so critical. I'm excited to be here. I'm excited to support y'all in any form or fashion that I can.
Thank you, Congressman, for your response. We are just so glad again to be here. We are an excited bunch, and we like to get the work done. And so I just want to invite Ms. Gonzales. I know you would like to introduce your health center and to our audience and have some questions for the Congressman. So please go ahead.
Thank you, Dila. As you mentioned, CHDI's main office is in Uvalde, halfway between San Antonio and the Mexican border. We have 5 cities caring for, we have 5 sites caring for 2 rural counties and 2 frontier counties. CHDI is a healthcare home for almost 11,000 patients, approximately a third of the entire service area population. Of course, 2020 was a very challenging year, to say the least. Let me just mention a few of our experiences. We implemented telemedicine in literally 3 days, updated all infection control protocols, and implemented electrostatic disinfecting facilities. We modified the facilities and appointment scheduling for patient and staff safety, initiated drive-up services for patients with COVID-like symptoms, and curbside pickup pharmacy refills. COVID testing has been provided, and now we offer COVID molecular testing in-house as well as COVID vaccines. Broadband connectivity was upgraded at an astronomical cost, yet speed is still limited. We retained our staff despite a significant reduction in program income. Telemedicine appointments continue, but an upgrade in equipment and broadband capacity, along with an appropriate level of reimbursement, is necessary. And we are deeply concerned about our staff's well-being, emotionally, physically, mentally, especially the front line. So Congressman Gonzales, thank you for being with us today and for your support of America's health centers. As you travel the district, what effects have you seen COVID have in our rural areas?
Yeah, the one thing that Rachel failed to mention is we also had a winter storm here in Texas that crippled communities all across the board. Electricity and water in many places were out for upwards of a week, and that was the difficult part of it. The wonderful part of it was the community coming together and solving problems, and the community health clinic there in Uvalde was at the heart of that. I think that's a story that should be told as well. It just highlights the fact that while we can have many differences, across demographics or politically or whatever it may be, when a crisis hits, we come together, and that's exciting. One of the things that I think is important, you mentioned rural broadband. That's an issue that we're working on, that we will continue to work on, because oftentimes in this pandemic, you've seen telemedicine really take hold and show the power of technology, and which is great, which is fantastic. But in many parts of my district, access to broadband is still an issue. That impacts healthcare, certainly, but it impacts everything: education, economic development, and the list goes on and on. So I think it's critical that we invest in these rural areas. Rural broadband is certainly at the forefront of that.
There's been a lot of misinformation about COVID vaccines. Some people in communities like mine are hesitant to get the vaccine for various reasons, and there are unique challenges to building trust in the vaccine. What are some of the ways you've seen this happening, and how are health centers essential to help building that trust?
Yeah, my district, very diverse, right? It goes from San Antonio to El Paso, and the pandemic is impacted the district in different ways. Here in the cities, in the city areas, it was impacted quite a bit, and folks were very hesitant to go out, and they were just much more cautious on things. Now, out in the rural areas, specifically out in West Texas, it was socially unacceptable to wear a mask. It just was, and a lot of that too was the number of transmissions were much lower. It was just a different environment, and that's tough for people to realize. If you lived in the city, you're like, oh my goodness, how can you, how can you not have these strict protocols? But if you lived out in the rural areas, you're like, well, why do you have these strict protocols? So I think it's important, one, for us to be respectful of one another. I think we need to get back to that. What I've pushed and what I will continue to push is the way we get past this pandemic is distributing the vaccine far and wide to not just the populated areas, but to the rural areas as well. And we encourage people to get the vaccine. We've done that. We'll continue to do that over and over again. There's been a lot of partners in this that I think have been helpful in that. I'm a veteran. I served 20 years in the military, and oftentimes the VA gets beat up quite a bit, and rightfully so. But the VA did a really good job during this rollout of helping with that. And I think the community health clinics have added to that as well. And it's about access, right? It's about access to the vaccine. Not everybody, their healthcare provider, they view it differently. It's not always the primary care physician that they see as their healthcare provider. It could be, let's say if you're on dialysis, or, if you spend the bulk of your time going to a clinic, then that's where you think your healthcare provider is. So what we've tried to do is, hey, let's distribute the vaccine out to all parts of it, not just the large concentrated areas. We'll continue to do that, but advocacy for the vaccine is, I think, how we defeat this pandemic and we get back to some sense of normalcy.
Thank you, Congressman. You know firsthand the challenges we face living in small rural communities, including healthcare, education, transportation, infrastructure. So many barriers and not enough resources. You ran for Congress to improve the lives for the people in your district. How can health centers help with those goals? And any final thoughts you'd like to share?
Yeah, look, in politics, you get pulled in all these different directions. And, I don't view the world that way. I spent my time in the military focused on a mission and working with others to accomplish that mission. You know, I didn't ask the person next to me, are you a Democrat or you're a Republican? You know, what church do you go to? Who do you go to bed with? None of that was important. What was important was, are you going to help me accomplish this mission? And in politics, it's much different. I mean, it's very partisan, and it's honestly one of the things that's been difficult for me to get accustomed to. I think one of the ways that we come together on things is we focus on what is important, and our family, I think, is key. Education, I think, is key. Healthcare, I think, is key. You know, maybe we might have different ways on how we get there, but we gotta talk about those areas, and we gotta dedicate the resources to it. You know, mental health, preventive maintenance, telemedicine, all these things I think are critical to communities in general. And the only way we can do that is if kind of ease up on the partisanship and focus more on solutions. That's how I view the world, and I encourage my colleagues to do the same.
Gracias, Congressman Gonzales. We look forward to working with you. Dila, we'll turn it back to you.
Thank you. Thank you, Congressman Gonzales. We so appreciate you being here. I'm so glad I had the pleasure of meeting you not too long ago, and just hearing your story and just hearing about your vision. And just quickly, do you just want to share just your vision that you have for your district and what you see going forward?
Yeah, absolutely. You know, I believe in partnerships. I believe in working with people to get things done. I also am not afraid to go to places that I think need to be highlighted. I mean, it's the reason why we went to Juarez. I mean, it's a different situation with the migrant situation, but I think it's important for us to talk about the things that maybe aren't comfortable. And part of that is you know, healthcare. It's a difficult topic because it's one, there's a lot of challenges, but two, it requires a lot of resources to address those challenges. So part of what I've tried to do in my time in Congress, and what I will continue to do, is just be a pragmatic, level-headed legislator that looks for ways to work with people to solve real problems that impact everyday Americans. And that's not always going to make the headlines, but one of the direct ways is going out, finding grants, finding federal opportunities, and bringing those directly back to my district and my state.
Thank you so much. And thank you again for sharing your time. We wish you well in both of those time zones. So thank you.
Great. Thank you, everybody. Y'all have a wonderful day.
Thanks, you too. Bye. Now, everyone, we are going to take a trip across the country, and let's move to the Northeast and to Vermont area to speak with Congressman Welch from Vermont and Michael Costa, the CEO of Northern Counties Healthcare. Gentlemen, welcome.
Good to be here.
Good afternoon.
I'm so glad you're here. So let me just read your bios first. Congressman Welch has represented Vermonters in Congress since 2007. And in an era of partisanship and division, he is widely recognized as a skillful legislator who chooses governing over gridlock. He was born in Springfield, Massachusetts, and graduated from the College of the Holy Cross. And as a member of the first class of Robert F. Kennedy Fellows, he fought housing discrimination in Chicago after college. I'm from Chicago. And went on to earn a law degree from the University of California, Berkeley. After law school, he settled in Vermont's Upper Valley, where he founded a small law practice. Congressman Welch was elected to the Vermont Senate in 1980 and later was selected to lead the chamber, becoming the first Democrat in Vermont's history to serve as Senate President pro tem. In Congress, Representative Welch is focused on delivering immediate aid to Vermont individuals, small businesses, and community anchor institutions hurt by the coronavirus pandemic. The congressman is also a leading advocate for energy efficiency, cutting the price of prescription drugs, investing in infrastructure, and expanding broadband and telemedicine in rural America. He serves as a Chief Deputy Whip for the House Democratic Caucus and is a senior member of the influential Energy and Commerce Committee. He is also a member of the House Intelligence Committee and the Oversight and Reform Committee. Thank you again, Congressman. And then finally, Michael Costa serves as the CEO of Northern Counties Healthcare, which encompasses 5 community health centers, 3 dental centers, and a Medicare certified home health and hospice agency in Northeast Kingdom of Vermont. Prior to leading Northern Counties, Michael devoted nearly 20 years to public service in states around the country. In Vermont, Michael served in both Democratic and Republican administrations, where he helped design Vermont's first in the nation all-payer accountable care organization model agreement with CMS, and Vermont's efforts to establish a universal health care program. Also, Michael has served as the Deputy Commissioner of the State Medicaid Agency, responsible for financial operations, managed care operations, the state's federal waiver, and payment and delivery system reform efforts. Michael holds a bachelor's degree from Bates College, a law degree from the University of Wisconsin, and a master's degree in healthcare delivery science from Dartmouth. So, gentlemen, thank you both for joining us. And Michael, I will turn this conversation over to you.
Thank you so much. And thank you, Congressman, for joining us today. I'll talk a little bit about our COVID experience here in Vermont. You know, as an FQHC, we decided on day one of this crisis that though COVID may change many things, it's not going to change our values. We're going to continue to do what FQHCs have done for decades, which is to continue promoting health in our communities. We immediately opened respiratory care clinics to keep seeing patients with chronic conditions who needed to be seen in person. We set up a telehealth service line for people who did not want to visit us in person. We created our own sewing factory to create PPE for our organization. Our staff volunteered at local hospitals and nursing homes, and we were the first FQHC in Vermont to offer testing and eventually vaccines. We also partnered with local arts organizations to create art-based interventions to combat social isolation so people wouldn't feel alone during COVID. Now, we can only do what we do because leaders nationally and locally have our back. And Vermont's health centers have no better friends than our congressional delegation, particularly Congressman Welch. So thank you very much for being with us today. And I want to ask you a similar question that we started off with Congressman Gonzales. But for our audience, when we use the term district in Vermont, we're talking about the whole state. And as our lone representative in the House, how have you seen COVID impact rural areas, and talk about the diversity of response across our state?
Well, it's affected. We're the biggest rural state, and it has been a huge challenge. Now, by the way, I just want to preface my remarks by saying I listened to Representative Gonzales. So everything he said, I agree with, right? So you've already heard, he spoke about great work you do, about the importance of working together, importance of the community health centers. And I love to hear that in his huge rural district in Texas. And it's the same thing. Michael and Higgs around the state are just doing an incredibly great job. And the part that I think is so unique about the community health centers is they're really on the ground. They're really in the community. I mean, so when Michael talks about getting people to knit masks, it is the capacity of a local organization to see what needs to be done, figure out how to do it. And they can only do that when they've got strong support in the local communities. And God bless you, Michael. I mean, that's an incredible story, but you know, a big institution, and that's how much of our healthcare is centered around now, these huge institutional players. don't have that kind of visibility into the reality of communities where in Vermont, we've got to make certain that the person who lives on a farm out in a long dirt road that you can't get there from here gets that vaccine. And one of the things about community health centers is that the whole point of community health centers is to provide local primary care to people in ways that make it easy for them to get the care they need. Okay, so you basically have a delivery system that is set up to meet the existing needs and circumstances of Vermonters, rural Vermonters, as opposed to having rural Vermonters have to accommodate themselves to the demands of large institutional providers, which they can't do and is very, very expensive. So on COVID, among other things, Michael, you know about this up here, one of our community health centers started mobile testing. If people can't come to the test, we'll go to the people. And I mean, isn't that just like a practical thing to do? But if you're in a small local organization and people are coming in saying, hey, Mildred can't get here, well, we can go to Mildred. You actually have that discussion. That's the kind of thing Michael and his board talks about all the time. Another thing they did, we're a largely white state, but we've got a diverse community, and the impact on our color here is much greater in Vermont, just like it is everywhere else. And there's a lot of reasons for that, but one of them are language barriers. We have a lot of new American community. Well, we have up here in Chittenden County, they established our community health center 12 different languages to provide information to people, so they had some real information upon which to get comfortable taking the vaccine. So, Michael's up in the Northeast Kingdom, and that's rural, really rural. It's poor, it's proud, and it's really hardworking people, and they don't need to be told what to do. Yet on the other hand, they really care about good health and quality, and they are really well treated. They're well respected for who they are and what they know, and their own wisdom and sense of integrity and decency. So, a major reason I'm so excited about the community health centers is that it's on the ground, primary care, neighbor to neighbor, and the people who work in our community health centers are dedicated to that kind of service. That's the model they want. They don't want to be at the big institution, and I'm not criticizing them now, but I'm saying that this model of primary care by local folks who are really integrated in the community is really, really important. And that's why it was so refreshing and wonderful for me to listen to Congressman Gonzales, who's got a huge district, totally different than Vermont, but not totally different, rather totally the same when it comes to folks needing good quality healthcare that our community health centers provide.
Thank you. And you talked a lot, Congressman, about this issue of trust, and how in a small state like in Vermont, trust in your neighbors is essential because almost everybody is your neighbor, and health centers as a key component of building that trust. And so what have you seen statewide among health centers to help build that trust in neighbors regarding vaccines, given the importance of implementing the vaccine right now?
Well, Michael, that's really, really a good point, because most of us are really affected by what our friends and neighbors are doing. And if everybody is recoiling from a vaccine, let's say, then we're going to be a little nervous, because obviously we all ultimately have to be trusting. We're not all scientists, we're not all epidemiologists. And of course, the community health center is a place where people of various backgrounds and various points of view go for their common need for health. So you're in the community health center, you see a neighbor there, or you're in your community and you're talking about where do you get your health care, and it's the community health center. So it becomes, sort of above politics, and it's even above sports, you know what I mean? Because everybody argues fiercely about March Madness or whatever the team, whatever the contest is. And if that's all you did, you're going to be fierce enemies. But in these communities, especially in the times are polarized politically, the community health center is a safe space where people can go, bring their children, and feel confident that they're going to be treated with respect and get the healthcare they need. So where you have that credibility in that local institution, and that local institution is offering the vaccine and saying very forthrightly that this vaccine can save your life, that's a big boost in trust. And we're seeing, there was a lot of vaccine resistance in the beginning. It's coming down, down, down as more and more people are doing it. But the safer the space, the better. And going in the center, I'm seeing it that I trust that she tells me, hey, this is good. And then I'm, roll up my sleeve. Time to roll up my sleeve.
Great. Thank you, Congressman. In our final moments, you came to Congress to improve the lives of Vermonters. How can community health centers help you with those goals? And what other final thoughts would you like to share with our audience today?
Well, you're kind to ask what you can do, since what you're doing is far more than what I'm doing. Okay, you're doing on the ground the real hard juggling of competing needs and priorities, limitation of time, space, personnel, resources. My job in many ways is it's to try to get the resources back to the communities in order for them to do their job. And it's really contentious in Washington. We did have January 6th, so that's its own topic. But the job we have really is to help Vermonters. And then when we get money back, like we've gotten several millions of dollars back to the community health centers to keep you guys going. The practical challenges of getting the personnel, of having them trained, of setting up the intake systems, of having the protocols in place to schedule an appointment, to have that person get the shot in the arm, to have that follow-up appointment. That is constant, day in and day out, care and attention. And I'm saluting you, the community health centers, because that's the job that you're doing. So my job is sort of done when we vote on our legislation and the money comes back and it gives you a shot at then being able to undertake that very, very demanding, attention-focused, day in and day out consistency that's required to build that trust that we were talking about a little while ago. So you're kind of asking me what you can do to help, but you're doing more than can reasonably be expected. And I really appreciate our community, your community health center in particular. I know the Northeast Kingdom, you'd love to come up here and, Mr. Gonzales thinks he's got a cool district in South Texas, but it ain't nothing compared to the Northeast Kingdom, I'm telling you.
I'm coming. Anything else, Michael? Thank you, Congressman. And I just want to say on behalf of all community health centers from sea to shining sea and our partners in Alaska and Hawaii, thank you. Thank you so much for all you do. And thank you for the investments that you have made, you and your colleagues,
thank you,
in the past budget bill. So thank you again.
Thank you.
Bye-bye. And Mr. Costa, thank you for hosting. We really appreciate you asking those questions. And so now I would like to turn everything back to Joe Dunn, Senior VP of Public Policy and Research at NACHC. Joe.
Well, thank you, Dila and Congressman Gonzales and Congressman Welch, Monica, Michael, and my colleague Emily for participating in today's event. Really enjoyed the discussion, the back and forth that we had today. So as you may know, NACHC is celebrating our 50th anniversary this year, and these monthly fireside chats offer an opportunity to highlight the impact of community health centers and the impact they are making every day across America, especially in the time when we're still fighting the COVID-19 pandemic. And we're honored to represent the voices of the 30 million patients, 14,000 nonprofit community health center sites, 253,000 staff, and 12,000 community consumer board members. And like I said earlier, very importantly, 1 in every 5 residents of rural America. So before signing off, I wanted to highlight a few other upcoming events that may be of interest to you. First is a question and question and answer session from HRSA regarding the recent $6.1 billion in the American Rescue Fund or American Rescue Plan funding to health centers. That event will be on Thursday, April 8th at 1 to 2 p.m. And the phone and login information was just posted in the chat. So please, if you have any questions around that funding, that would be a good opportunity for you to listen into that. Second is a roundtable session on the Health Center COVID-19 vaccine program sponsored by several national training and technical assistance partners. This is a bi-weekly forum for information exchange on Health Center COVID-19 vaccine program and includes updates from the Bureau, from Suminair, and is intended really for Health Center clinical leaders, the C-suite, administrators, providers, and other staff. The next one of these sessions is April 9th and another one on April 23rd from 1 to 2 p.m. Eastern. And lastly, the next webinar in this NACHC series is going to be next month on April 27th at 2 p.m. Please look for information regarding the program and registration. But thank you again for participating, and I hope you have a great rest of your day. Thank you.